Of the Jackson office of the Michigan Department of Health and Human Services, Zoe Lyons. Good morning, Zoe.
Good morning.
Morning.
How are you?
Good, welcome back.
Getting
Thank
ready
you.
for school, which is, how does your office change when school starts?
Well, we are full of backpacks.
Yes.
So we have a church that we work with, and they donate backpacks for all of our children in foster care, and we get those out, and then we give the rest to families who just might need them that are working with our other programs. But that's the biggest change, I think.
Since you were here last, the Medicaid redetermination period reopened. Our national emergency ended, so we, at that point, then we had to requalify for Medicaid.
Correct. Yeah, so the entire time that the country was under the public health emergency, anyone who was on Medicaid, their case didn't close. So normally, every year, there's a redetermination for anybody who is on Medicaid, and you sort of reevaluate if they still qualify for Medicaid. Maybe they got a different job and that has insurance, or they make more money, and so every year we do that redetermination. We did not do that the entire time of COVID because we wanted everyone that was possible to have health insurance in case they got sick. So with the ending of the public health emergency, starting in June, we began sending out those redetermination packets to everyone on Medicaid.
And so if somebody got that in the mail and set it aside, which people are frequently want to do, is there any way, do you follow up and say, hey, we're looking for your redetermination app?
Yeah, well, there's not an automatic follow-up. So what will happen is they'll find, if they forget about it, they'll find out when they get a closure notice. That's what will happen. So we're urging everyone, a couple of things, and I think we've mentioned this before. Make sure your address is correct, because we want you to get your forms in the first place. And then when you do get your redetermination forms in the mail, go through them, sign them, turn everything back in. We ask for something called verifications. So that might be proof of income, or change of income, or change of family members. And so we want that to get mailed in so that we can do that redetermination and hopefully keep that Medicaid case open for them.
So many folks on Medicaid or other services that can't advocate for themselves or have a hard time. If they get Bart and I are filling something out, no problem. But there's so many people that don't really have any experience or help. What can you do for those folks?
I would say come into the office. So one of the things that we learned during COVID is that we can all sort of survive in a virtual world, right? So lots more phone calls, video chats, Zoom and Teams and those types of meetings. And the same is true for our clients that we work with. And so we've been able to do a lot more on the phone, so they can call. They can come into our office. We have kiosks open in our office in the lobby, and people sitting in our lobby. We have 2 staff members in our lobby here in Jackson waiting to help folks navigate the system, because it can be confusing.
Did the rules change where people that might have been eligible for Medicaid before and during the pandemic suddenly found themselves not eligible?
Well, rules are constantly changing, just a little bit. But probably if their circumstances haven't changed, they're probably going to be okay. But we also want people, even if their circumstances did change, even if they think they might not be eligible, they still might. So we don't want people to make any assumptions that they won't be eligible. We want them to go ahead and fill those forms in, send them in, and see. Because if you're eligible, we want you to have that benefit.
Bridge, Michigan reporting that there's some 20,000 people that were eligible before that aren't now. What is the department able to do for those folks?
Well, there's so the Michigan Department of Insurance and Financial Services, DFIS, is working with us at MDHHS to help those that might be impacted to try to find a way that they will still receive some kind of coverage. And I know here locally, we've been meeting with, I've been meeting with Henry Ford and with Center for Family Health, really working on our messaging for our community as well. And one of the things that our health providers are saying is, we want you to come in and still get health care. We can figure that out. And then we work with them so that if it's Medicaid that they're actually eligible for, even though they might have let it close or didn't think they could, then we're working as a team to get that done as well.
We can't let you go without talking about the need for foster parents in our county, and the need is always there.
It is always there, and boy, this summer has been, it's been a lot, and it seems like it always comes up at the end of the week with weekends coming, where we're really struggling to find a home for one or two children, and they're typically older children, right? So, and we consider older about age 10 and up. And so just if anyone knows someone who's ever contemplated it or has been thinking about it, we just urge you to give us a call. You can call 888-MISH-KIDS, and they'll answer your questions, and they'll get you connected here with us locally. Yeah, always a need for us.
And here in Jackson County, there's a lot of people that are part of Michigan Healthy Plan or Medicaid. Nearly a third of people in Jackson County.
Yeah.
That's
it's
a lot.
great. It's great, because we really want people to get their health care taken care of, right? Extends life, helps our children, so it's a really important benefit to have.
Great. Thanks for all the updates, and if anybody has more information about Medicaid or any of the other MDHHS services, you're the person to call.
Absolutely.
Thanks, Zoe.
Thank you.
Thank you.
Zoe Lyons, the director of the Jackson office for MDHHS. More of the morning